Like I'm going to discuss the anatomy of thoracic vertebrae of dog. In case of dog, there are 13 thoracic vertebrae. The thoracic vertebrae form the roof of thoracic cavity along with the proximal end of ribs. The characteristic feature of these thoracic vertebrae is the pair of articular facets which are present on these vertebrae, and function of these facets is in articulation with the pair of ribs with which they are attached. So these articular facets which are present at both the cranial and caudal end of the thoracic vertebra is its characteristic feature, and their function is in articulation with the ribs. Thoracic vertebrae have long spinous process, as you can see in this picture. There is a thoracic vertebra which is known as anticlinal vertebra, and this anticlinal vertebra is a thoracic vertebra with the most vertically oriented spine. And this in case of dog, the anticlinal vertebra is the vertebra number 11. So in case of dog, the 11th vertebra has the most vertically oriented spine, and it is the anticlinal vertebra. All spines which are present just cranial to this anticlinal vertebra are inclined caudally, while all the spines uh, which are present caudal to this anticlinal vertebra are inclined cranially. So this is the 11th vertebra, which is also known as anticlinal vertebra of dog. If we talk about the body of thoracic vertebrae, then the body of thoracic vertebrae is short with flattened extremities, and there are two extremities. One is the extremitus cranialis. This is the cranial extremity. This is the cranial aspect, and other is the extremitus caudalis or caudal extremity, which is present at the caudal aspect. And caudal aspect of this thoracic vertebra is not visible in this picture. This is the cranial aspect of thoracic vertebra. These extremities actually function as an attachment site for the intervertebral disc. Now, if we talk about the transverse process of the thoracic vertebrae, then the transverse process of these thoracic vertebrae is thick, short, and undivided. This whole is the transverse process. This is the transverse process. Each transverse process has a non-articular mammillary process. This small area, is the mammillary process of transverse process of the thoracic vertebra. So this mammillary process is non-articular process, and it is present on this transverse process. And the second point which is present, which is very important in case of transverse process of the thoracic vertebra, is the transverse costal facet. This is the transverse costal facet. This transverse costal facet actually helps in articulation with the tubercle of rib with which it is attached. So here proximally we have mammillary process, and ventrally we have transverse costal facet for articulation with the corresponding rib. This transverse costal facet is also known as fovea costalis processus transversi, and so it is located on the ventral aspect of transverse process, as you can see here. Another important feature which is present only in the thoracic vertebrae is the costal facet. Costal facets are plane surfaces that articulate with the head of ribs. So in case of thoracic vertebrae, we have four costal facets, out of which uh, two are present at the cranial aspect of the thoracic vertebra, while remaining two are present at the caudal aspect of thoracic vertebra. So the cranial costal facet which is present here is also known as fovea costalis cranialis, and as you can see it is present on the cranial extremity of vertebra, and it articulates with the caudal part of the head of rib. This is the cranial costal facet, and the other cranial costal facet is present here near the extremitus caudalis. The caudal, if we talk about the caudal costal facet, then the caudal costal facet is present uh, on the caudal extremity of vertebra, and or it articulates with the cranial part of head of rib. This caudal costal facet is also known as costalis caudalis. This is the costalis caudalis, this part. It is not much visible in this picture, otherwise it is present here, the caudal costal facet. So as I have told you that the cranial costal facet articulates with the caudal part of head of rib, while the caudal articular facet articulates with the cranial part of head of rib. Now there are four articular processes in the thoracic vertebra of dog. Two are present at the cranial end and other two are present at the caudal end. So these two are called cranial articular processes. These are the cranial articular processes. One is present, one is this one, and the other is this one. And similarly, at the caudal aspect, there are two articular processes which are known as caudal articular processes, and this is the caudal articular process, and other is present here. The other structure which is present in the thoracic vertebra of dog is the cranial and caudal notches. This notch, this is the notch, cranial notch. So totally there are two cranial notches and two caudal notches. The cranial vertebral notch is also known as incisura vertebralis cranialis, and similarly the caudal vertebral notches are also known as incisura vertebralis caudalis. These notches help in the formation of intervertebral foramen for the passage of spinal nerves.